Many people that I see are unhappy with their appearance. They feel like there's fat or adipose that they would like to reduce, and they're not sure exactly the best way to do that. And so some individuals choose non-surgical fat reduction, which would be something like CoolSculpting, which we have in the office here. And basically, this product reduces fat by freezing it. A patient has a treatment cycle that's approximately 35 minutes, sitting comfortably in a chair, reading their iPad or watching television, and then resume their normal activity with no downtime. The classic patient that comes in is a patient that is overweight, but is busy, a busy professional, and those individuals will hope to do CoolSculpting because there's no associated significant downtime. However, I've had other patients who are highly motivated, and these are the individuals too that just say, I want a one procedure or one or two procedures and be done. And so these individuals will be a better candidate sometimes for a surgical body contouring procedure than a non-surgical procedure. Many patients aren't a candidate for CoolSculpting. It's appropriate to come and be evaluated because otherwise a person could spend thousands of dollars and not get the outcome that they're hoping for. With surgical liposuction or body contouring, we would hope to remove 70% of the desired fat from a particular area if it's done in an appropriate way and the patient's the appropriate candidate. CoolSculpting and contour distinction with each session removes about 20 to 25% of the desired fat reduction. So with any body contouring procedure, if there is destruction of the fat cell, or if the fat cell is aspirated and removed, those fat cells that have been destroyed or removed aren't going to return typically unless a person gains about 100 pounds over their ideal body weight. The remaining fat cells, however, can expand, so they'd be much like a balloon that could get larger. So it's possible that a person could regain weight or adipose in that area, but it wouldn't be necessarily those same fat cells coming back. It would be other fat cells that are expanding and getting larger. Typically, an individual deposits fat based upon a global distribution of fat or a genetic predisposition to store adipose tissue in certain areas, and this varies from individual to individual. Before I purchased the CoolSculpting machines, I test drove them, we'll say. And so I have a little lower abdominal adipose above my belt line that really bugs me when I'm at the beach. And so one side, as just like everyone is, one side had a little more adipose than the other side, and so I said to the rep, well, I want to try this on the side that has more adipose tissue that I can see myself when I look in the mirror or when I look down from above. And after one treatment, I was able to see a visible difference at 12 weeks. And so based upon my own trial in the right candidate, and thank goodness I was the right candidate at the time, there was improvement in my appearance. And so I think in the appropriate candidate, it's a good option to consider.